I think my favorite part of the work that I do is my interactions with the students and knowing that, I've helped them along the way with whatever they need to do, whether it's a sports physical and they can finally go play soccer.
So there was a patient of ours who knew that she wanted to play sports, and she was worried that she wouldn't be able to do that. Her family wasn't able to get her to a provider for a sports physical. And so when we opened, she came to see us, we helped her register, she was able to play sports, and because of that, she let us know that she was able to really just make friends and build on the passion that she knew was there, but she wasn't able to do in the past.
So school-based health centers are small primary care clinics located on a school campus.
I think about us as being sort of small but mighty. We're basically a smaller version of what you find in the bigger clinic.
So we provide any health care, preventative care, behavioral health care. We have a pharmacy.
We also have psychologists on site, students dealing with stress at school, stress at home, depression, anxiety. We can help with all of that.
A couple of the reasons why kids don't graduate are mental health concerns, pregnancy or substance use disorders. By offering robust set of health services inside of schools, we can sort of address those or even prevent them.
Most definitely you can tell a difference with student attendance and then their grades.
The students aren't missing much school, they're in and out in a half hour.
It is also helpful because a lot of families in our area, they can't take time off of work to take their students to the doctors.
I think when a lot of kids start high school, like they get their vaccines and whatnot, but they just kind of think like that's the end of it. I'll never go back to the doctor again until I have like a health problem. But us being inside the schools lets them know that like it's a part of your life, going to the doctor and seeing a health care provider and that sort of thing.
Our mission is also about health equity, right? If you look at health statistics and health disparities, you'll see that in King County, a lot of the need is really in the south end of the county. Most of the existing school-based health centers outside of Health Point are located in kind of Seattle proper.
Our student health ambassadors are a group of students who care about their own health needs and their peers' health needs.
Where it allows the students to kind of form a panel and identify what is it that the students at the school need, not what Health Point needs or what Health Point wants the school to have. The students come to Health Point and say, this is the sort of stuff that we need to be educated about. An example of that would be Suboxone program. We know that opioid abuse is rampant in the community, and we are seeing it sooner in schools right now.
So then that's when we start kind of working together on like, okay, what will catch the students' attention? Should we do a video? Should we do a PowerPoint? Should we join an assembly? Or just what can we do to make sure that we know where to serve the students and how to serve them?
And it's great to talk to the students about all of the different avenues in healthcare that are available to them, even inside of Health Point. I actually started as front office at one of our community sites, and from there, I kind of worked my way up and I found my way into school-based, and that was really rewarding. If you're someone who loves engaging with the community beyond patient care, school-based is the place for you. It also allows you to kind of take that next step in your career. There's lots of leadership skills that you learn, especially being in the clinic coordinator role.
Sometimes my friends are like, well, what do you do? And I'm like, it's like not one thing. Like I do hundreds of things all day, but that's why I like the job, because I'm not doing the same thing every day. Every day is different.
I just think it's cool coming from the sister site, CTAC, that I meet a lot of the parents of the students, and coming here, I recognize a lot of the kids already. Like, I already know your mom or your dad, and I've seen you, and it's just cool to watch them grow. I have one kid in particular that I know his grandparents, his parents, and him since he was 10 years old, and now he's a senior here, going to graduate. I feel like I'd cry sending them off to college or something.
Midway is extremely proud to partner with Thomas Jefferson High School. I myself have learned a lot from the school-based health centers. As a site manager, I tend to focus more on the day-to-day of the clinic. The school-based health center has actually helped me do a lot more outreach.
So We're not just a clinic inside of the school. Hope Point is moving more towards a community-based care model. The school-based health centers are kind of leading the way in how that integration happens. Our work does not exist without partnerships with the school, partnerships with our sister sites, partnerships with like other organizations, King County Sexual Assault Resource Center, Child Haven, King County Public Health.
There was one girl who, and every day she'd come straight here. I let her come in here, I let her sit, give her a snack, like, cause I think she just wasn't comfortable, but home life wasn't comfortable either. So when I see kids like her, I just identify like, you just need a comforting space, even if it's for a little bit. Just letting it be an open and comfortable space for everybody is my biggest thing.
So our goal, I would say, is to make sure they know that we care about them, they matter, their health matters. My hope is that when students connect with Health Point in their schools, they're realizing that their community does care about them.